right, so now we're going to kind of do an overview of immunity. This is going to cover parts of chapter 16 through 19. You still need to make sure that you read these, but this will give you an overview of certain concepts throughout those chapters. In this particular slide, you have a flow chart of the immune system. If you'll notice, our immune system has two branches to it. It has a non-specific response branch, which is known as your innate immune system or your natural immune system. This is discussed in chapter 16. You'll also see over here that you have the specific response. This means it's adaptive, meaning that it can change over time, and you acquire this as you're exposed to different types of pathogens. This is discussed in chapter 17. So if we look back over here at the natural immunity, or what we call the innate immunity, this is going to have your first and second lines of defense. In your first line of defense, this includes all of your barriers, your physical barriers. This will be like skin with your normal flora, your normal microbiota that's located on your skin, your mucus and cilia that are part of your mucosal membranes, your hair, which can be located in your nose, trachea, eyelashes, things like that, and also the process of washing. Washing is going to be the use of tears, urine, vomit, defecation. All of these are going to water down, or the sense of dilute, a pathogen and potentially get it removed from the body. There's also some chemical secretions that are also part of this first line of defense. This includes the gastric and vaginal fluids. They have a more acidic pH, and that can inhibit the growth of some pathogens. We also see that your sweat, your perspiration, as well as tears and saliva all have some enzyme activity, specifically the enzyme lysozyme. We then see in your second line of defense, this is going to include inflammation and fever. This is still part of the innate or natural immune system. We also see that we can activate some of your phagocytic cells like neutrophils and macrophages. We also see activation of a system called complement, and also production of a chemical called interferon. These are all part of the second line of defense. Your third line of defense is part of your adaptive immunity. This third line is going to focus around special white blood cells called lymphocytes. There is two sections or branches to this third line. There's what we call the T cells, or the cell-mediated branch. This is going to be very helpful in treating viral infected cells, as well as protozoa and helminths, so the worms. On the other hand, the B cells are going to be a humoral type of response, meaning they're going to release antibodies. These guys are going to be really good at fighting against toxins, viruses, and bacteria. Now again, down here at the bottom, it shows you that the innate or the non-specific part of the immunity contains the first and second line of defense, whereas the adaptive just contains the third line. If you notice in chapter 18, there's a practical application that deals with the immune system, and then chapter 19 is the immune system disorders. So let's look at some of this innate immunity first. It's a non-specific response, meaning it's natural, meaning it's present at birth. This provides a rapid response, but there's no memory to it, so it doesn't remember what it's fought before. This is going to include, again, the first line of defense, which is going to be your skin, as long as it's intact, because if your skin is broken in any way, whether it's a cut or an abrasion or anything like that, it opens this up, and so the first line of defense doesn't work as well. The mucous membranes, as well as their secretions, as well as the normal microbiota. The second line of defense are your phagocytes. These are going to be like neutrophils, eosinophils, dendritic cells, and macrophages. These are the cells, when I say that they do phagocytosis, they're the ones that are going to consume and eat the invader and then kill it from the inside, kind of like Pac-Man in a sense. We also see that there's inflammation, fever, and antimicrobial substances. On the other hand, with the specific response, or the adaptive or acquired immunity, this is slower to respond, but it does have memory. So this is going to create memory cells, which allows you to remember it in future cases so that you can fight it faster. This is talked about in chapter 17, and this is the third line of defense. Okay, it's specialized lymphocytes that are your T cells and your B cells, as well as the production of antibodies. All right, so looking at the first line of defense, these are going to be barriers to prevent invasion. You have some physical barriers, which include the skin. This is the dermis and epidermis. These are the layers of the skin. You also have the mucous membranes, as well as the lacrimal apparatus. Your lacrimal apparatus is your tears. Coughing and sneezing also allows you to get rid of potential pathogens. Hair, cilia, and the elimination of fluids through like urination, defecation, and vomiting can also help you get rid of things. We also see there's chemical factors that are part of this first line. This is your sebaceous or oil glands. They create sebum. Also your sweat glands for your perspiration, and then also the production of tears, saliva, nasal secretions, and so on. And then the gastric juices. The gastric juices are going to be your stomach acid, which allows for a lower pH and kills most harmful microbes. If you look over here in the picture, it shows you most of these and where they are located, as well as lysozyme breaks down the cell walls of gram-positive bacteria. This is why it's a good enzyme for your secretions to have in it. The last thing that's part of the first line of defense is going to be your normal microbiota. This causes competitive exclusion, meaning that it's going to help outcompete potentially bad invaders. So the pathogenic bacteria cannot gain access because you have normal bacteria that can grow there better. This is going to bring us to probiotics. These are going to promote growth of the beneficial microbes, particularly in your fecal coliforms, which means in your gut, your intestines, and this is going to help prevent potential infections there. So taking a closer look, we're going to look at the skin. The skin is composed of the epidermis. This is the outer part of the skin. This is going to be a thick layer of dead epithelial cells, and these epithelial cells have a certain kind of protein in them called keratin. This is going to help them keep a tight seal and be almost like a waterproof barrier. This is going to be several layers wide of smushed cells. Okay, it's called stratified squamous epithelial. As long as this remains intact, pathogens cannot get into the deeper layers of the dermis, so it acts as a very good barrier. But if the epidermis is cut or harmed in any way, whether it's burned, punctured, this can actually allow pathogenic organisms to get in, and that's when they can cause infection of the skin. Common infections include bacteria in the Staphylococcus family, and these are from your normal skin flora, but if they can gain access into your body, they could potentially make you sick. With the mucous membranes line any kind of natural opening to your body, so they're going to line your gastrointestinal tract. They're going to also be part of your respiratory system and your genital urinary tracts. These guys are going to secrete mucus. This mucus helps trap organisms. Most cannot penetrate the epithelial surface due to this mucus that's present. Most pathogens enter only when the membranes are damaged. So again, just like we saw with the skin, if they're damaged in some way that offers an opening, this will allow the invader to potentially get in. Damage could occur from things like abrasions, inflammation, viral infections, particles that you may have inhaled and taken down deeper into your respiratory tract, and also toxic substances that can be secreted by the pathogen itself. We talked about some of these endotoxins or exotoxins who actually are causing the problem, not the bacteria. Some other physical factors in your first line of defense include your lacrimal apparatus. The lacrimal apparatus is located in the eye. Okay, you have what we would call lacrimal glands up here that are going to produce tears. Those tears are going to move across the eye surface, and they are going to help with washing. This is going to continually cover the cornea and help protect it, but it also is going to help keep microorganisms from settling and infecting the surface. So it helps wash them away and remove them. This is also going to have some enzymes present like lysozyme. We see coughing and sneezing can help you expel or get rid of a microorganism or a toxin from your upper respiratory passage. It allows you to physically get it out of there. Hairs in your nose can actually trap some microbes as well, which then can cause you to sneeze. The cilia and the epithelia in your lower respiratory tract can also move microorganisms up, or dust and pollen, as well as pollutants. The ciliated epithelia can also secrete mucus, which could trap invaders. They can then push the materials upward back to the throat to where you either cough them out or you cough them up enough to then swallow them into your stomach, where then the stomach acid can help get rid of them. Expulsion of materials from the gastrointestinal tract is often caused by bacterial viral toxins. These toxins can cause the body to go through vomiting and or diarrhea. This again though is to dilute the invader and hopefully get them out, but it is something that's not necessarily very comfortable to deal with. Now, in the first line of defense, we also have some chemical factors. Some of the chemical factors include your sebum, which is an oily secretion from your sebaceous glands. These are located in the skin. This helps protect your skin by causing a lower pH. Most bacteria can't grow in acidic conditions, and so because of that, it makes it where it's not as favorable for them to grow. Lysozyme is an enzyme that can break down the peptidoglycan in the cell wall, specifically the cell walls in gram-positive bacteria. This can be found in several secretions that you produce, as sweat, saliva, mucus, and even the urine. We then see the gastric secretions of the stomach glands can cause the high acidity in your stomach, which we call stomach acid. This protects from most bacterial growth and can destroy also most toxins. However, there are a few that can grow in these acidic conditions, or they can at least survive the acidic conditions. Then they get into the intestines and they can potentially cause the problem. Okay, but again, these are areas of that first line of defense. Another thing that's part of that first line, or the innate immunity, is the normal microbiota. Microbial antagonism or competitive exclusion. This is where healthy populations of normal flora can outcompete other organisms for food on your body surfaces. This allows them to be able to take over and be more prominent and make the pathogens have a harder time growing. The normal flora also can help maintain the high pHs on the surface, and probiotics are a good bacteria of the intestines. This adding probiotics to your daily routine can help keep your intestinal flora healthy. Some cases of this is certain kinds of yogurts and things like that. If you've seen the commercials of Activia, and it talks about helping keeping you regular, this is adding probiotics to help move your food and your digestive system in a healthy way. Some studies show that ingesting probiotics during intestinal problems can resolve issues faster because you are putting back good bacteria, which ultimately can outcompete the bad. Ingesting probiotics during antibiotic therapy can also maintain intestinal health and prevent antibiotic diarrhea, because sometimes what happens when you're on antibiotics is it can also hurt your good bacteria. And if it gets rid of your good bacteria, then you have secondary side effects like antibiotic diarrhea because you've gotten rid of the good bacteria. If you'll take probiotics, it can help potentially prevent some of those side effects. Now, the second line of defense is your body's defenses that are going to happen after the first line has not worked. Okay, so they've gotten past your first line of defense of either the physical or chemical barriers. Now your second line has to pick up the slack and potentially try to get rid of it. This is the body defenses if the microbes get through that first line. So we see here the first part we want to look at are what we call leukocytes. Leukocytes are a type of white blood cells. We see that if you have what we call leukocytosis, this is an increased number of white blood cells, but if you have what we call leukopenia, it's a decrease in white blood cells. Some infections cause leukocytosis, whereas others cause leukopenia. It depends on how they attack this line. If this line's able to create more white blood cells to fight the infection, you have leukocytosis. On the other hand, if these cells are the ones that are hurt by the invader, it's going to cause leukopenia. The way we determine this white blood cell count is through what we call a differential white cell count. This is where we can classify the different types of white blood cells by their percentage. Certain percentages could let us know that's high or low and maybe what kind of infection we're potentially dealing with. Adults and children have different normal ranges, so it's important to note the age of the patient. And we do see that there are two different types of these leukocytes. They can either be what we call agranulocytes or granulocytes. So when we look at granulocytes, this means they have little grains in them that can be stained. These little granules or grains are going to have chemicals that help them potentially fight the invader. And you can see them here. The eosinophils, the basophils, and the neutrophils all have these little grains that are easily seen once they are stained. Agranulocytes mean that they don't have those grains present when they are stained. They may still have some of these to help potentially fight invaders, but you don't see them when they're stained. And so when we put A in front of the word, it means not or without, so without the granules. These are going to be the lymphocytes and the monocytes. Now, if you'll notice, each of these cells looks a little bit different, and the reason that they're a little different is that they also are going to potentially fight things in a little bit different ways. Some are going to be very good at fighting off bacterial infections. Others are going to be better at protozoans. Others are going to be better against viruses. It just depends on what kind of invader gets in to which cell may need to be activated first. Now, a lot of these can be all activated at once. However, certain ones are going to be better at fighting it than others. Now, most of these guys do what we call phagocytosis. This is why they're known as phagocytes. Phagocytes include your neutrophils, eosinophils, basophils, and monocytes. Monocytes, when they mature in your tissues, they actually get renamed as macrophages. Macro meaning large, and they're very large cells. Now, phagocytosis is the process of consuming a smaller cell or substance, so it actually consumes it, brings it into its body, and then destroys it. Phagos means to eat, and cyto means cell. So this is a cell that eats the invader. Now, in the PowerPoint that we'll post here, you can click on this phagocytosis and it'll take you to a video that shows you the steps of this process. You also have them listed in your textbook. Now, in the second line of defense also is going to include inflammation. Inflammation is a local tissue response to an injury. There are 4 cardinal signs or symptoms of inflammation. This includes redness, also known as erythema. Erythema is the medical term for redness. We also have heat, swelling, which is known as edema, and then pain. Redness and heat are due to what we call vasodilation in the area. So when damage has occurred in the area, the blood vessels in that area will dilate. They get larger. This is going to bring more blood in, and blood has that red color, and this is what causes the redness. Blood also has a higher temperature than your body temperature, and this is what brings the heat. We also see in this whole idea of vasodilation, since the blood vessels are getting larger, it's stretching them, they also are going to leak more. This means that they have increased permeability. Fluids are going to leak out of them, and this causes the swelling and the pain. As the blood vessels start to increase their permeability, we see that the white blood cells can get out there more to do their fighting, but so does some of the plasma or liquid from the blood. Okay, this is going to be helpful for the phagocytes and some defensive chemicals, but this extra fluid in the area starts to put pressure on your pain receptors, which causes you to have pain in the area. There is sometimes a fifth sign of inflammation that can occur, and this is loss of function. This is due to the fact that there's extensive swelling in the area, edema, that it causes you not to be able to use that area, loss of function. Okay, so an example is if you had a cut on the finger and you had the swelling, the redness, the heat, the pain, and then you also couldn't bend it, you couldn't use the finger, then you also have the loss of function. Now, tissue repair occurs during and following inflammation. This is going to allow the tissue to start repairing itself, being able to fix the potential issue, but it does continue after inflammation leaves. YouTube links here about inflammation and tissue repair that you can click on. It talks about just different types of the process of inflammation, the whole idea of them being vasodilated vessels, as well as the permeability, as well as then the tissue repair. All right, and so you can take a look at these on your own time. Another thing we want to look at in the second line of defense is fever. Okay, so inflammation was a local response to an invader or an issue, damage. Fever is going to be a systemic or a whole body response. This can be triggered by bacterial infections, toxins, or even viruses. What happens here is cytokines cause your hypothalamus to reset the thermostat. Okay, and so in your brain, you have an area of the hypothalamus that is going to contain all of your homeostatic regions. Okay, making sure you have a homeostasis. And normally your temperature thermostat is set at around 98.6 degrees Fahrenheit. What happens here is that these chemicals get released by damaged cells or the toxins released by bacteria or viruses, and it causes the hypothalamus to reset the temperature. Okay, it's like going to your thermostat, and instead of setting it at 72 in your house, you then set it up at 74 or 76 or so on. This is going to cause it to raise your temperature. Now, you do feel chills in this process, and these chills are actually caused by your muscles doing the repetitive contractions to start to actually generate more heat. Okay, so the whole point of your chills and your shivering that takes place when you have a fever is so that your muscles are actually producing more heat to raise your body temperature. Vasoconstriction occurs in the skin to reduce heat loss, and so the blood vessels will start to constrict and pull away. Doesn't mean you're not getting blood to your skin, but this is why a lot of times you may appear pale. And the increased body temperature causes increased cellular metabolism. It makes your cells work harder. This then causes them to even generate more heat. Now, there's a fine line with this. As the fever starts to get higher, it does actually help the body fight the invader until a point. Once temperature gets too high, it actually starts to denature our own proteins, which then can be detrimental. The purpose of a fever is that most pathogens are mesophils. They like that middle of the road temperature, so they cannot live in those higher temperature environments. But again, it can cause complications for our own cells because our cells like that mesophil temperature as well. This can cause you to have tachycardia, which is increased heart rate. Metabolic acidosis, which just means that your body is giving off more acids and making your blood more acidic, which can hurt the bacteria but can also hurt some of your cells. It can also cause dehydration, electrolyte imbalances due to your sweating that takes place. It's not good just to put back the water in the dehydration. You also need to put back the electrolytes. This is why when you go in, if you're severely dehydrated into the hospital, they don't hook you up to an IV of pure water. They hook you up to an IV of saline. Saline has sodium and sodium and chlorine in it, which is salt, to help with the electrolytes. This could lead to also seizures if it starts to cause problems in the brain, as well as delirium and potential comas. Death can actually happen at temperatures that range between 44 and 46 degrees Celsius, which means that your body temperature gets to 112 to 114 degrees Fahrenheit. Now, this is life-threatening. Guys, if people have a high fever that's over 106 degrees in adults, that is a major problem. And a lot of times if people come in with fevers that high into like an ER or a doctor's office or something like that, they want to try to cool them down quickly, and this is what they'll put ice packs and stuff on them because they've got to reset that hypothalamus. Okay, the hypothalamus is thinking that it's helping, but it actually keeps turning up the heat, which causes them to have damage to their own cells as well. Also part of the second line of defense, we can look at the antimicrobial substances. This includes something called the complement system. The complement system consists of a group of potentially more than 30 proteins. We're finding more and more as we study this system. They are produced in the liver and they circulate in your bloodstream and your tissues. However, they're circulating right now in an inactive form. They do get triggered to where they can assist the cells of your immune system in destroying the microbes. Complement proteins must be activated by being split apart, okay? And so right now they're in an inactive form, but when they come in contact with an invader or a pathogen, they split and break, which then allows them to then trigger a cascade. So complement 1 can then trigger complement 2, which triggers complement 3, and so on. These activated fragments work with cells to destroy the microbes. And one way they can do this is they can weigh down the microbe or the invader, causing them to slow down so your immune system cells can get close enough to destroy them. It's kind of like if a football team has like a really good player and you have more and more people jumping on them to slow them down. That's kind of like what you see here with the complement. There are two pathways that complement can actually be triggered. One is called the classical pathway, and this is initiated when antibodies bind to an antigen or the microbe. They start this process where complement 1 triggers 2 and so on. We also have the alternative pathway, which is initiated when complement proteins themselves will bind to the antigens. All right, so sometimes they'll have the normal system where antibodies are going to cause this to be triggered. The other time, complement will be triggered itself by coming in contact with the antigen. You'll also notice on this slide that there is a YouTube video related to complement. All right, the next thing I want to look at are the interferons. With the interferons, these are antiviral proteins that are produced and released by your host cells that have actually been invaded by viruses. And so you can kind of think about these as like a silent alarm. Like when there's a bank robbery or something like that, then the teller can send that silent alarm, which notifies the police department and notifies other areas. However, the virus or the robber does not know that that may have been activated. The same thing can happen here. When a cell gets invaded with the virus, it can send out this signal to the cells around them. It can then protect the surrounding cells to help keep them from being infected. It helps the unaffected host cells be able to fight against that viral invasion. So normal or neighboring healthy cells can respond by producing antiviral proteins, which then will destroy the viral nucleic acids if they try to enter their cell. So it allows them to have kind of like a heads up that, hey, I've been infected, however, protect yourself. Okay, in that sense, that's what they're doing here. It does disrupt viral replication cycles. And so remember that viruses have to replicate inside of your cells. So if your immune cells can't get to them, these cells can also help by producing these interferons. We see that this is host cell specific. It's effective though only for a short period of time. They eventually will run out, and if we don't get that viral infection under control, those cells could ultimately still be invaded. Some are being used to treat certain cancers, or actually using them to look at certain cancers as well as hepatitis B and C and multiple sclerosis. The next thing that's part of this second line of defense are the iron binding proteins. Most pathogenic bacteria require iron in order to grow. They've got to get this from your body. So the body cells will compete with the bacteria for this iron. If your body cells can take up the iron and not give it to the bacteria, then it potentially can cause the bacteria to not be able to grow. Iron bonding proteins prevent the iron from floating free in the blood, so bacteria cannot access it. These iron bonding proteins include things like transferrin, lactoferrin, ferritin, and hemoglobin. These guys can all bind that iron so that it's not usable by the bacteria. However, some bacteria, because our cells have started doing this, have adapted to use mechanisms from stealing the iron from these iron binding proteins, or by phagosizing those proteins to use the iron. So when we see here, they've come up with adaptations, mutations that allow them to be able to still access that iron even when your cells are trying to prevent that. All right, so that was kind of an overview of chapter 16. Now we want to get into the adaptive immunity, and the adaptive immunity is talked more about in chapter 17. This is your specific defense, which means that your defense is different than anybody else's because you've been exposed to things differently than others have. So with adaptive immunity, this is going to be specific to you. So let's look at some terminology that's part of this adaptive immunity. Adaptive immunity targets specific pathogens. It must be triggered or activated. This is unlike the innate immunity. The innate immunity doesn't care who it's fighting. It's just like, hey, there's an invader and it attacks it. The adaptive immunity is going to kind of have more of a game plan. It's like, who's invading us? Okay, it's this. This is what we're going to do, and this is who's going to fight it. So it comes up with more of a plan. This brings us to the two types or two branches that are part of this adaptive immunity. You have the humoral immunity, which involves antibodies. These are going to be produced by your B lymphocytes, also known as your B cells, We have the cellular immunity, which involves the T lymphocytes, or also known as T cells. These are going to attack pathogens in different ways than using antibodies. It's kind of more of a hand-to-hand combat in a sense. So when we look at this, antigens are any microbe, chemical, or particle that triggers an immune response. It's an invader, whatever this invader might be. So this is something foreign to your immune cells. That's something that does not belong. We also have antibodies. Antibodies are also known as immunoglobulins, or Igs. These are proteins that are made by B cells in response to a specific microbe, again, a specific invader. Now there's two types of responses. We have a primary response, which means it's the first encounter you have with that particular pathogen. This means it's the first time you've seen it, therefore it's going to take a little longer for you to have the response. A secondary response is any future encounter. So it could be the second, third, fourth, fifth, sixth time you've encountered that particular microbe. This is going to happen after the primary, but this means the same pathogen gets in and your body is now ready to fight it. And this is going to include things that are called memory cells, who are going to remember that invader. So going back to antigens, antigens are most commonly proteins or polysaccharides on the surface of a microbe. However, toxins can also trigger this or be called antigens as well. Non-microbial antigens can also trigger an immune response. Some examples of these are things like pollen. Microbial antigens can include things like pollen or egg whites or other things that can cause allergies. We also see blood cells or serum can also trigger this if they give you ones that don't match you. This is one reason why they want to do a cross match a lot of times before they give you a blood transfusion. And then of course tissue markers, which can be found on your tissues or organs before transplant, because we got to make sure again that it's a close match. Otherwise your immune system is going to start attacking them as an invader, even though you really need that transplant. Antigens have what we call an antigenic determination site on their surface. These can go by several names. They could be called epitopes. We also see pathogen-associated molecular patterns, or PAMPs, toll-like receptors, TLPS. There's lots of different things that we can end up calling these, but the main thing is that they are a site on the surface that causes them to be foreign, that your immune system notices that it does not belong. Haptens are very small antigens. These are usually not recognized by your immune cells unless they are attached to another cell. So if they gain attachment to another cell, then they can be detected, but they are so small for the most part that they go undetected if they're not found on a cell. We then want to look at the antibodies. Antibodies are also known as immunoglobulins, or IgSs. These are proteins that are going to be highly specific, and they are going to react with only one type of antigenic determinant, or epitope. So when we see here, they are going to be very specific, and this is why it's part of the specific or acquired immunity. This is also why it takes a little longer for us to build a defense against something, because we are going to figure out what it is and then fight it very specifically, very strategically. And so when we look at these antibodies, they have a distinctive Y shape that's here. This Y shape is going to have some heavy chains and some light chains, and the V's here are showing you the variants. These are the parts that can change or be different based on what microbe or antigen they are attaching to and fighting. Now in your textbook it shows you some classes of these immunoglobulins. It shows you that they can have some different types of shapes. The IgGs are going to have the distinctive Y shape. They are considered a monomer because of this. 80% of your antibodies are this particular antibody. These can be found in your blood, your lymph, and your intestines. They have a lifespan of approximately 23 days, and they are going to be really important in helping enhance phagocytosis, neutralizing toxins and viruses, and they also protect the fetus in newborn. These ones can actually cross the placenta. We then see the IgMs. The IgMs are a pentamer shape, meaning that they've got these 5 different Y-shaped structures here. So these guys are really large. They're only about 6% of your total antibodies. These are going to be found in your blood, your lymph, your B cell surfaces. These guys only last for about 5 days, or survive about 5 days, and these are especially effective against the microorganisms and certain kinds of antigens. These are actually the first ones that are produced. So in your primary response, the first time you've seen the invader, IgMs are the first ones to be made. Now after the IgMs have gone in and started doing their attack, IgGs will normally take over after that. IgAs have a dimer look, meaning they have the two sides. This is approximately 13% in the serum. These survive for about 6 days, and these are located in a lot of your protection areas of your mucosal surfaces. So these are going to be found a lot of times in body fluids. These are actually the ones that get passed from mom to baby during breastfeeding. So these guys are actually in the breast milk as well. IgDs are a monomer. This is a very small percentage. It's 0.02%. They survive for about 3 days, and they have a serum function that's not known. We don't really know what they do yet, and these were actually discovered in the 1960s, and we still are not exactly sure what they do because their percentages are so low. It's hard to know exactly what they do. However, the presence on their B cells functions in initiating of the immune response. So we do know that they help with the B cells in some way, but in the serum or blood, we're not sure exactly what they do. The IgEs are also a monomer. This is going to be also in very low amounts, but these are going to be bound to mast cells and basophils, and these are going to be culprits of allergic reactions. They also are helpful in fighting parasitic worms. The reason we know that these are associated with allergic reactions is these numbers do climb when somebody starts to have an allergic reaction and potentially go into anaphylactic shock. And so we want to keep these numbers down if that's a potential issue for that person. So when we look here, this is how the humoral immune response kind of works. All right, so when you see here, you have your stem cell. The stem cell is located in the bone marrow. These stem cells can be stimulated to become a number of different things, whether it's a red blood cell, white blood cell, or platelet. In this case, they're going to be stimulated into becoming a B cell. These B cells are going to be the cells that produce the different immunoglobulins or antibodies. And so once they get initiated, they're going to start producing those immunoglobulins, and they are going to create what we call plasma cells. These plasma cells are the ones who are actually going to create the antibodies. That is their sole purpose, and they are going to start making these antibodies in large amounts to go in and fight the invader. On the other hand, once they have detected the antigen, some are going to also become what we call memory cells. These memory cells are there to help remember who they were fighting, so that when you come in contact with a second time, they can actually produce these antibodies a lot quicker than they did the first. So when we're looking at the primary humoral immune response, primary immune response is when the B cells start their cloning. This is when they first encounter the specific pathogen. So cloning just means they're going to make more of themselves. They're going to end up doing mitosis and making more of themselves. The activated B cell then matures and produces two different types of populations. And so proliferation is producing more of themselves. Differentiations when they're going to become either one of the two types. So they're either going to become plasma cells, which are going to be responsible for producing antibodies, or they're going to become memory cells, which are going to help, of course, with remembering. So the plasma cells produce the antibodies designed to attack that specific antigen. Okay, and it's going to cause them to be triggered to start producing that. These antibodies are secreted into your circulation and your bloodstream. Only IgM antibodies are produced in the primary response. This will then be followed by the IgGs in the secondary response. So if the same pathogen decides to come in and try to invade you again in the future, it will trigger the memory cells. The memory cells are then going to trigger your secondary immune response. Once stimulated, the B memory cells will differentiate some into plasma cells. These plasma cells will then begin the process again of producing antibodies. This doesn't take as long because the memory cell's already there, it's already partially matured, and so it allows it to create those antibodies a lot quicker than starting from scratch. This is going to produce IgG antibodies, and they're produced for them secondary plasma cells. Now, a lot of times when we see that individuals will go in and they may want to take some blood work to look at how your immune response is working, they may do what we call an antibody titer. These titers are going to detect the relative amount of antibodies in your blood, your serum. They can tell us by a percentage of IgMs versus IgGs, and this can let us know if this is the first time that your body has seen the infection or if it's the second time, depending on if IgMs are higher or IgGs are higher. All right, and so this allows us to be able to make some of those distinctions. Your initial exposure happens here on day 0. We see that the IgMs are the first to be made, and they are made to help start the process of fighting the infection. IgGs start later, okay, and they are a larger amount because they're smaller and easier to make, and they stay in the system for a little bit longer as the IgMs start to decrease. When the second exposure takes place, IgMs can still be present, but if you'll notice, they create the same amount that they did in the primary infection. Whereas the IgGs, the second exposure to the antigen creates a huge amount. amount of the IgGs to fight the infection. So this allows us to be able to look at the titer and be able to tell if it's a primary or a secondary infection. Now, your adaptive immunity can be gained in two ways. It could be naturally acquired or it could be artificially acquired. So when we look at naturally acquired, this could be through an active natural system. This is where your own body produces your antibodies because you're actively making the antibodies, and this is where you've actually had the disease, and so because of that you've developed antibodies, and it's a longer lasting protection because you've also produced memory cells. We also see that you can have natural passive immunity. This is where antibodies are passed from the mother to the fetus. This can go from the infant also through the placenta and also the milk from the mother to the baby. All of these are passive, however, they're still a natural form. But the baby is not actually producing its own antibodies here, they're just borrowing them, and that's where the passive comes in. It is still a natural way for them to be able to borrow them. On the other hand, if we look at artificially acquired, this is where you're going to be given it through an injection. We see this a lot of times with your vaccinations. So this first one's an active artificial. This is where we're going to stimulate your body to produce the antibodies. We're going to actively make your body make them, but you weren't exposed to the disease naturally. We injected it through an immunization or a vaccine. We also see that we have passive artificial. This is where the antibodies are donated from another person and they're injected into you. One example we see of this is if a mother is Rh negative. Okay, if the mother who's pregnant is Rh negative, she gives birth to an Rh positive baby. We don't want her body to make antibodies against that, because if it does, the next pregnancy she has, if the baby's Rh positive, it will attack and kill the baby. And so we give them an injection of borrowed antibodies called a RhoGAM shot. This allows the mother to borrow the antibodies. The antibodies destroy the baby's blood cells that got mixed during childbirth, and this then allows the mother to not produce an active immunity against it or a memory against it. All right, and so this is when antibodies are donated, and this is going to be only a temporary type of immunity. So if we look here, this is just showing you a flow chart where you have your adaptive immunity could be either naturally acquired or artificially acquired, and it gives you the natural active, natural passive, artificial active, as well as artificial passive. So take a look at this and make sure that you can distinguish the difference between these kind of four groups of adaptive immunity. All right, so we talked about antibodies. Now let's look at the cell-mediated response, which is part of this adaptive immunity as well. This is going to be more of the hand-to-hand combat where the cells are going to be actually attacking other cells. This is going to be where the stem cells do start in the bone marrow as well. They are going to produce lymphocytes, but these lymphocytes, instead of maturing into B cells in the bone marrow or the spleen, they're going to migrate and mature in the thymus gland. When they mature, this is why they're called the T cells, because they have matured in a different area of the thymus gland. These T cells will then migrate to the lymph node tissues, whether it's the spleen, your lymph nodes, and other areas like the liver, things like that. We see recognition of antigens by the T cells requires that they be attached to a specialized antigen presenting cell. This is known as an APC. This is something like a macrophage. So the macrophage takes in the invader and then lets us know by putting out like a flag or a signal, and so these T cells can know that, hey, something is up. We have an invader in this area and we need to now go give help. It's almost like they're calling for reinforcements or backup in this sense. The T cells must be able to see these APCs. This is also known as the major histocompatibility complex, or MHC molecules, along with the antigens. So this allows them to be able to tell what potentially they're running into. Who is the potential invader at this point? Now, when we're looking at these T cells, there are different types of T cells. The first ones are known as the helper T cells, or the TH cells. These are going to help with the use of chemicals known as cytokines. These are going to stimulate the conversion of cytotoxic T cells into what we call cytotoxic activated killer T cells. All right, and so it's going to activate, kind of almost like the assassins in this sense. These activated killer T cells are going to recognize and kill the target cells through apoptosis. Apoptosis is programmed cell death. So it causes that cell to kind of sacrifice itself in order to provide protection for the rest of the organism. So the helper T cells are going to release the cytokines, which then converts the cytotoxic T cells into cytotoxic activated killer cells. Now, the types of cytokines that could be used are things like interleukins as well as interferons. Cytokines are proteins. These are proteins released from cells that regulate the immune response. So they can directly or indirectly cause fever, pain, and even the T cell proliferation, making more T cells in order to then fight the infection. Another thing that's important to note about the helper T cells is the helper T cells are also the communication between the cell-mediated and the humoral response. So the two branches of your adaptive immunity are connected by these helper T cells. Okay, so the helper T cell is going to help with that connection between the two so that they're communicating. Because a lot of times, guys, when an invader comes in, we actually need both sides of the immune system to help us fight it. One just might be the primary fighter where they get backup from the other one. All right, but they both need to be in on what's going on in the body. And the helper T cells help with that coordination. So if you look here, this is just going to give you kind of a rundown. You have your helper T cells. They're going to activate cells related to the cell-mediated immunity. They can also help activate macrophages and natural killer cells. We also see there's the helper T cell type 2. These are going to stimulate production of eosinophils as well as antibodies like IgM and IgE. And again, this is where there's that connection between the two branches. The other type of helper cell is the Th17 cell. This is going to recruit neutrophils, stimulate production of antimicrobial proteins. We then see the cytotoxic T lymphocytes. They're going to destroy target cells on contact. They are generated from the T cytotoxic cells. We also see some regulatory cells. These are going to help you regulate your immune system. This is going to help maintain self-tolerance, being able to tell what belongs to you and what doesn't, so that your immune system doesn't just go crazy because it's so excited about fighting something off that once the invader is gone, these regulatory cells say, hey, you've done a great job. Back on up. We don't need to hurt our own tissues. All right. So it keeps them from hurting potentially ourselves. We also see activated macrophages as well as natural killer cells, which are part of this group. Now, this brings us to looking at some potential disorders of the immune system, which are talked mostly about in chapter 19 in your textbook. One example of these are allergies. Allergies are overreactions of the immune system to invading particles that are not normally harmful. That peanut hasn't done really anything to you. That banana is not hurting you, but your immune system thinks that it's going to. So it's an overreaction. It's a hypersensitivity to something that's normally not harmful. Allergens are any antigens that stimulates the allergic response. So for some individuals, this could be pollen, and this could be kind of like a seasonal allergy where you only have them in the springtime when stuff's blooming. It could be animal hair. This is why you might be allergic to a cat or dogs or things like that. Mold can cause this, as well as even a insect sting like a bee sting. Okay, that bee sting, yes, it hurts, but it shouldn't kill you. Okay, but some people are hypersensitive to it, that once they're stung by that bee, it potentially causes a life-threatening reaction that could cause death if it's left untreated. Allergen signals your mast cells. This is a type of tissue white blood cell, and these start to release histamines. Histamines are then going to cause the inflammatory response. This gives you symptoms like sneezing, runny nose, restriction to your respiratory system potentially. And so the treatment normally is through antihistamines. This is why you might take something like Sudafed or Benadryl, or if it's on your skin surface, you may put on a type of hydrocortisone cream. Okay, that's an antihistamine to stop this allergic type reaction. Another thing we want to look at are the autoimmune disorders. Autoimmune disorders are diseases in which the immune system fails to recognize some of the body cells as self. We're supposed to teach the T cells in the thymus gland that this is you, this is not you. This is you, this is not you. So that when your cells are surveying the area, they can say, oh, that's me, oop, that does not belong, it's not me. The problem with autoimmune disorders is that their immune system cells are thinking that they don't belong. Okay, that cell that's part of your liver or that cell that's part of your intestines does not belong when it really does. So a lot of times these autoimmune diseases are going to be characterized based on what area they're attacking. All right, so like juvenile diabetes is an example because the immune system has normally attacked the pancreas, causing it not to be able to produce insulin anymore. Rheumatoid arthritis is where the immune system is attacking your own joints when it shouldn't. Multiple sclerosis is where it's attacking a certain cell in your brain called the oligodendrocytes, which causes your nerve cells in your brain to misfire. Lupus is a really bad one because it can actually trigger and cause your immune system to attack multiple areas of the body, which can cause liver issues as well as the spleen, digestive problems. The person's hair can fall out in a lot of different areas. Okay, and so autoimmune disorders do get characterized by where the immune system is doing its attacking. We also see severe combined immunodeficiency. This is also known as SCID. This is going to be when you are born. without an immune system. So the immune system never develops like it should. And so this would be like if you've ever heard about the boy in the bubble, when they did those studies where as long as he stayed in that bubble and we kept all the germs and stuff out, he was fine. The reason is he didn't have an immune system to fight off the invader. This means he wasn't born with it, and his immune system was not able to develop over time. All right, so he's not able to acquire it. Now, different from the SCID where they are born with an issue, we have what we call acquired immunodeficiency syndrome. This is also known as AIDS. AIDS is caused by the HIV virus. It's a latent virus who gains access into your helper T cells. Now recall, just a couple of slides ago, I was talking about how the helper T cells are that communication and that connection that activates the antibody side of the immune system as well as the cytotoxic T cell side, allowing them to be able to fight the invader very efficiently. It's going to take that link out. It's going to take out the communication. And so because there's no communication between the two sides of the immune system, the antibodies are like, they'll take care of it over there with the cytotoxic T cells. And the cytotoxic T cells will say, the antibodies will take care of it. And there's no coordinated attack. This weakens the immune system, and the immune system starts to falter and be useless because of this. The HIV virus is going to be transmitted person to person. This is normally due to intimate sexual contact or the exchange of body fluids. It could also be due to sharing needles. It could also be due to blood transfusions. However, this is less common now that we know what it is. Back in the 80s, we didn't always test for this in the blood because we didn't know what it was. Now that we know what it is and what it looks like, we can test blood samples for this to prevent it from being given off in blood transfusions. However, it can also cross the placenta. If the mother is HIV positive, it could potentially cross over into the developing fetus, and the baby could be born HIV positive. Now, prevention, there's no vaccine for this. We have no way of really getting ahead of it right now. So once you get it, you have it. We don't have a way of getting rid of it. We do have some medications that can slow it down, where we have found that people that have HIV can live for a very, very long time before it turns into full-blown AIDS. So we do have some medication that causes the viral replication to be slower and things like that, but we don't have any way to cure it or to prevent it. Now, some preventative measures and the whole sense of controlling the spread are through sexual abstinence. That's the only surefire way you're not going to get it. Using condoms can also help. Using sterile needles, and then also education. Educating people on how they can get this, how they can prevent transmission. Also educating especially healthcare workers on making sure that you take precautions like everybody has HIV, because the patient doesn't have to tell you they have HIV. So unless you've had blood work or something done, you may not know that patient has it. So you take the precautions like everyone has HIV. Making sure you wear your gloves properly, you take the normal precautions when body fluids are present. All right, so education is really important in this. So this is kind of your little bit overview of HIV, which then ultimately leads to AIDS, which is acquired immunodeficiency syndrome. So what HIV does is it takes out the immune system, making it where it can no longer fight infections. Guys, people don't die from HIV or AIDS. They die from some secondary infection like pneumonia or the flu or the common cold, because their immune system no longer can fight it. In past chapters, you might recall that we talked about that these are not diseases that a lot of the diseases were like childhood diseases, or people who were immunocompromised, like AIDS patients might get them. And this is because their immune system cannot fight those simple infections. All right, so this kind of gives you an overview of chapter 16 through 19. Again, make sure you're reading them in your textbook. If you have any questions or concerns, please let us know.